Hello, my name's Anna Dixon. I'm Chief Executive of the Centre for Ageing Better. We're a charitable foundation that wants everyone to enjoy a good later life, and we work to create change in both policy and practice informed by evidence here in England. So we've got a really great panel lined up for you today, and I'll introduce them each in a moment. Just to give a little bit of context to this panel, obviously the impact of COVID-19 is being felt particularly on ageing populations and on the economy. So that is the context for today's conversation. So the questions about how do we support people to age well, how business can respond to the needs and wants of an ageing population are obviously changing very rapidly in light of that. Addressing these issues is going to be hugely important and hugely challenging too. So how we shape the future through this crisis, I'm sure, will also be something that the panel will want to touch on. So I'd like to welcome our panel today. Firstly, Debra Whitman, who leads Public Policy Research, International Thought Leadership and Work on Brain Health at AARP. AARP are a non-profit membership organisation which represents 37 million Americans aged 50 and older. Welcome, Deb. Secondly, John Godfrey, who is Corporate Affairs Director at Legal & General. They're a major provider of pensions and later life housing, and are also recently announced funding £20 million of research into later life care at Edinburgh University. So hi, John.
Hello. And
finally, Andrew Scott, who is Professor of Economics at London Business School, and also the co-author of now a best-selling 100-Year Life, and also author of a new book shortly to be published called The New Long Life, which we look forward to reading, Andrew. Hopefully along with my forthcoming book.
Indeed, yeah.
Aging Better, just to put a plug in for that. Great, so let's kick off really just with thinking about what do we need to do to support people to age well. We talk a lot about people's needs, but also perhaps as we're talking about them as consumers, what their wants and aspirations are. So, Deb, do you perhaps want to kick off with just telling us a little bit about what you think we need to do as a society to support people to age well?
Well, I think aging well has a lot of different components. So aging well encompasses our physical health. How can we increase our health span? So we live not only long, but without disease or disability into later life. It encompasses our financial capacities. So how do we make sure that people have the resources that they need and that they don't run out before their lives do? Also, their brain health. How do we make sure that people stay sharp and don't face cognitive decline, dementia, Alzheimer's, all of those things which tend to increase as people age. And lastly, remain a socially connected part of the world. Nobody wants to live long and by themselves. And I think this time of COVID-19, where we're all hanging out in our homes, as you can see the background of each of ours, it is increasingly hard as we age to maintain connections, as many of our friends and family pass away and that our living situations may change. I'll make one point on all of those because I think it will be a major part of our conversation today, is just how much the disparities are in each of these areas, particularly in the United States, where I'm sitting and where I'm most familiar. The disparities of longevity are huge. Women in the top 1 percentile in the US live 10 years longer than women in the bottom. Men live 15 years longer than men in the bottom. On financial capacity and savings, the numbers are astronomically different for the top and the bottom. So I hope as we talk about all of these areas, we really look at how we can help those at the bottom lift up, as well as making sure that everybody is secure.
Great, thanks for that overview, Deb. Andrew, what would you say is the progress we're making on extending lives and longevity? how are we sort of going to, I suppose, protect some of the gains that we've made in terms of aging well and longevity?
In reference to COVID, you're referring to, or just?
Yeah, potentially, yeah.
Yeah, and I think what's fascinating about coronavirus is sort of, obviously it's incredibly multidimensional. We don't know how it's going to play out, but it's just accelerated a leap into the future across so many different areas. How we use technology, for instance, and how we blend work and life. The inequalities are going to be made very apparent in terms of how we respond to this crisis in all sorts of different ways. But also, you think about the biggest issue right now, it's how do we trade off saving lives with protecting the economy? And most of those lives that we're trying to save are those of the older population. So we are right away seeing this sort of challenge of an aging society, how to have a healthy economy and how to have a healthy population, particularly amongst older age groups. And I think what is so interesting is how all the issues that all us as panelists have been talking about the last few years are coming to the fore, like, is 65 old still? How many years left has someone who's 80, and is it still worth investing in their health? Should we allocate resources to the old, or should we allocate resources to the young? The notion that everyone over 65 is of bad health and vulnerable. And, we've still got this really out-of-date approach to age. We need a more nuanced approach, and that's causing us a major problem in this coronavirus. And of course, I think the worst indication of that is what you're seeing happening in care homes right now. We knew that care homes weren't operating very well. It still was one of our major solutions to a major problem in life, and it is a tragedy what is happening in there right now. So I think, obviously, in the midst of a global health crisis where mortality is going to be unusually high, it's hard to talk about longevity. But if you look at how COVID and the mortality risk rises with age, it's exactly the same gradient as all other diseases. So in a way, this has, in a very, very dramatic form, just revealed how unprepared we are and how we need to be more prepared for the future.
And John, coming to you, do you think there are things we can learn during this crisis about how we need to support people to age well?
Yeah, I think this will be a tremendously, tragically disruptive crisis, but we need to take the right lessons away from it. The first thing, I think, and Andrew touched on it, is that the aftermath of this will potentially show quite a discord between generations, which we need to find ways to solve. It has been primarily a health crisis for older people, but primarily an economic crisis for working age people. And younger people who've had the least health impacts, but have the longest time to pay back the amount of government debt that will have been borrowed against the crisis. So when we do the rebuilding piece afterwards, we have to rebuild in ways that match the expectations of the people who will be repaying that debt. So that, in other words, means addressing issues like climate change at the same time. So we want to have a multi-generational solution to this. The other way in which I think we need to adjust after this is to pick up the long-term sort of systemic shortage of investment there's been in the care system for older people. It's been built on very shaky foundations for decades in the UK, and those foundations are now absolutely wobbling. So we need to revisit that properly. It should be a catalyst for the government to get on and deliver the Green Paper and the serious system-wide reform and thinking that it's been promising for years.
So I think, Debs, you started by highlighting some of those inequalities. And I think we're seeing, aren't we, through this crisis, it's really exposing just how differently different people are experiencing this. One of the issues that we work on at the Centre for Aging Better is housing. And obviously, being confined to your home is a very different experience if you have a garden and are not living in overcrowded conditions. And we know that many older people who experience disability already find that their homes are, not well designed for them. So do you want to say a little bit more about how you see the inequalities in how we're aging playing out?
Well, I think more broadly in the US, we've seen the inequality in the death rates be astronomical for people of color. People of low income, and these are people, many of whom are still going to work every day. The appreciation for care workers, for example, grocers, delivery people, all those people that provide services to young and old, I think has been one of the highlights of the coronavirus epidemic, but also showcasing that many of those people also are sort of living in low-income environments, obviously having more exposure and more risk. So I think both young and old, and I liked the multi-generational solutions that John was talking about earlier. I do think that whatever that we're looking at, we realize that younger and older people live in homes that are unsuitable. Younger and older people live in environments where they're often close together, the rise of multi-generational households in this country. And so I guess I would turn it into a little bit of how can we mobilize a lot of the intergenerational solutions that we're seeing coming across the countries of people helping each other, older people tutoring younger people delivering food to older people, for a whole range of different solutions. Now, you mentioned housing, so let me just touch on that because I know it's an issue that's near and dear to your heart. Very few homes, I think, in most countries are adaptive and that have things like universal design that allow people to get into them. And back to we need to have a master plan for the care sector. A big piece of that is a master plan for our housing sector. How can we look at building requirements or zoning requirements that allow homes to meet the needs of anybody that would come to visit or live there through their whole life? We've worked a lot on accessory dwelling unit legislation, which in this time period is extremely useful. So these are granny flats or nanny flats, ways to have in crowded areas or high cost areas, have co-living situations that are on premise that are sometimes separate. So again, I think this terrible pandemic may open up conversations and new solution setting in ways that we haven't thought about before. But I want to make sure that we're addressing the needs of all generations as we do it.
So John, do you want to come in? I mean, L&G, we're talking here about the business response, and in some ways, L&G are very much part of that and an innovator in terms of certainly housing for the future. What do you see as the opportunities there, and indeed in how we deliver care in the future?
Well, I think the opportunity has been there for a long time, and the need actually has been there for a long time to have more choice around housing for older people and indeed for everyone. We just have a chronic shortage of suitable housing in the UK across all forms of tenure, not just the owner occupation piece, but rental as well and affordable. So we need to get much better at building sufficient housing that works for older people and indeed for multi-generational occupancy across all these types of tenure. And we need to do it not just through creation of housing, but creation of communities, an outdoor space and environments that work for older people as well. So that has always been there. I suspect that will become even more pronounced post-COVID because the absolute importance of trying to keep people living independently as much as possible and as much as possible in their own homes rather than going into residential care will, I think, push us towards greater emphasis on housing and greater emphasis on domiciliary or care at home rather than residential care. So I think we'll see these things happening. The other piece that's going to be very interesting, I think, is the impact of technology. Because, anecdotally, I've seen, my 90-year-old father-in-law for the first time understanding how you can order groceries online and things like that in the last 6 weeks. So, there will be a wholesale change in the way people operate their daily lives, and that should encourage greater independence. But we need to help people to get there.
Andrew, do you agree that there are opportunities with technology and disrupting sort of how we've done things previously that could open up opportunities in the future?
Yeah, I have to say, a little bugbear of mine working at business schools, I hear the word disruption far too many times. And I think COVID has shown us the true meaning of the word disruption. So I think we should probably reserve it for that. But I take the point. Yeah, I mean, we're always looking for tech solutions to problems. What's the biggest untapped market the tech firms haven't yet swallowed up? And that's older people. If, as I think looks likely, we're going to see a phased reintroduction of the economy, but older people still being sheltered, then I think you're going to see a massive step increase in providing tech services to that group. So I think we will see that. But I'd like to go back to the generation issue. And of course, one of the things I think, it's amazing how many words have been written about COVID. And I hope this won't be the pandemic that leads to the highest ever death toll, but it will be the pandemic with the most words written about it, I think. But one of the things that really isn't much talked about is the fact this is the first pandemic when the world's population has consisted of more people aged over 65 than under 5. And that fundamentally changes everything. I've been playing around with some numbers looking at the US. I had a piece in Project Syndicate published this week saying that if you look at the changing distribution of age in the US today, it warrants a much longer period of social distancing than, say, 1920 with the Spanish flu. It's about a 4.5 month shutdown in terms of GDP is worthwhile compared to 1.5 in 1920. And that's the source of this sort of generational conflict that we're worried about. But I think we've got to be really careful. I think, what this crisis is throwing up is just how inadequate our systems are in thinking about age and longevity. And I totally agree that everything has to be multi-generational. I think if you take the longevity agenda seriously, you have to worry most about the young, because clearly the current life course is least suitable for them, and it's already strained for those who are old. But I think we keep thinking that the young stay young all the time. And, what longevity means is really, I think, a fundamental change. The first is, if you're a 20-year-old in the UK, you're now, you've got most of your grandparents still alive in their 70s today. In 1920, you wouldn't have done. So actually, although there is a cost to you and your job, you can see the benefit in terms of your household and family, because you've got so many members of your family alive that you're protecting. So I'm not saying there isn't an intergenerational conflict, but in many ways it's less now because of longevity and so many generations being alive together. The second thing is, if I was a 20-year-old in the face of a 1 in 50 year pandemic, I'd be very interested in how 70-year-olds are looked after. And again, if you go back to the Spanish flu, an American or a UK 20-year-old had only an evens chance of making it to 70. Today, it's 80-90%. So actually, I know when I'm young, I'm going to be old in a way that wasn't the case 100 years ago. So I totally agree about the need to work on intergenerational solutions. I just worry that we flip it to this concept of young and old, which is different from generations, because every generation starts young and become old, and longevity means your chances of becoming old are much, much greater than they used to be. So I think that's kind of a better way of trying to phrase it into a neutral territory.
Although I think there's been quite a lot of discussion about, some of the way in which this is positioning is maybe reinforcing some of the stereotypes by, using a sort of catch-all of vulnerable for everybody over a certain age. And obviously, more stringent measures have been applied to those over a certain age in some countries. And, there have been some quite divisive public discourses about rationing life-saving care. So I just wonder what, perhaps you're doing, Debra, in the US around some of the sort of potential ageism that we might be seeing and countering some of that debate.
I agree with what you'd said. I think there has been a lot of association with older people as a block with being fragile and vulnerable. And I don't think that is helpful, because there are younger people that have health conditions that make them vulnerable as well. And so we've really worked hard. In the US, we have strong laws against age discrimination, and particularly age discrimination in healthcare, to make sure that policies look at an individual's health, not just their chronological age, as a determination for receiving care. The government has put out regulations on that. Again, you can't discriminate because somebody's a woman or because of their age, and a whole bunch of other categories here in the U.S., which we strongly support. But I do, and we also haven't hit as hard, other than in New York and a few locations, the scarcity of resources where the hospitals are having to make those kind of decisions. We're concerned about the reopening, and I know this is going to be broadcast much later than this, because some places are thinking about age bands for allowing people to go back to work. We worry about that. Again, older people are in the workforce. We have a multi-generational workforce. People need their wages, whatever age that they are. And so making sure that all of the policies that come in line, even understanding that risks are higher, particularly at very older ages and people with chronic disease, that we need to be careful of using just age as a marker for ability and capacity, both on the healthcare sector as well as in employment.
Andrew, maybe you want to come back in on the sort of labour market issues around age and the extent to which participation is going to be impacted differentially by different generations.
Yeah, I mean, I think this is going to be I think, I talked about how this is triggering off lots of misunderstandings, but I think it is a really difficult issue, as Deb says, because obviously we know chronological age is only a crude approximation to a person's health. But if you are looking to save lives, I think governments will be introducing labour market restrictions based on age, and that's going to be a real challenge. I think it's also an interesting shift because the general shutdown we're seeing at the moment is based on an externality that young people may not suffer as much as old, but they would infect them. So you stop them. Whereas this is about older people making a choice about whether to expose themselves to a risk. And I think that's a very different type of policy from what we've seen so far. But clearly, I'm afraid the labour market implications of this are going to be grim, full stop. We know we're going to see a huge spike in unemployment. We hope we're going to see a sharp recovery, but I can't see that recovery getting us back to where we started from by next year. So we're going to see a prolonged period of high unemployment. And that's going to be a real challenge for older workers, because if younger workers are allowed back in first and there's a big increase in unemployment, we know there's all sorts of prejudice about hiring older workers. So I think we do have a real challenge here, because we know that pension funds with people who are invested in them or recipients of them have seen a big decrease. So that's going to increase the need for many people to carry on working for longer, at the very same time as they may be unable to carry on working for longer, given the way the labour market operates. And that's going to be really, really hard. And there's no easy solutions to that. We've got government legislation about age discrimination, but we already know that there are problems in the labour market. We know that people have been working for a lot longer. We know that, I calculated that nearly all the employment growth we've seen in the last 20 years in the US and UK, most of it's come from older workers. But if they lose their job, will they get rehired again? Yeah. And I think that's going to be a really, really big challenge. The only solutions I can see are going to be a raft of sort of, entrepreneurship and self-employment from people. But it will be difficult.
Okay, we'll maybe come back to some of those solutions. And certainly I'd like to pick up in a minute with John, about the sort of the business response to this. And obviously as a large employer yourselves, how you might approach this. But Deb, did you want to come in and give a perspective from the US?
Yeah, I just agree with Andrew. I think the labor market has always had a lot of discrimination in it. And back to that inequality that I talked about, we just recently released a report on the longevity economy, how big a market older people are in this country. And one piece of it we studied was how big would the economy be in the US if we didn't discriminate against older workers? What if we allowed people who wanted to work the ability to have a job, or wanted to change jobs, or had a shorter search than, down to what younger workers have? And that would have grown the GDP in this country by 4%. By 2050, it would have grown GDP by 6%. So I think that age discrimination is a tax on our economy. And as we look towards growth and market opportunities going forward, we need to make sure that that our leaders are looking at ways to make sure that the people who want to work can find jobs, and particularly older workers who face this head on. Lastly, in that study, we found that the people who most face age discrimination are women, people of color, and people with low income. So the people who are already discriminated against face more discrimination as they age. And so once again, when we look for solutions, we need to look at whole solutions.
Exactly, the intersectionality is critical in that area. So how are businesses, I mean, already obviously L&G looking at how you diversify your workforce, but any sort of thoughts from you about the sort of business response to this challenge?
Well, I think Debra is absolutely right to say that age discrimination is a tax. It's also a colossal waste. Now, the COVID situation could be as disruptive in terms of labour markets as Andrew suggests. I mean, what we're seeing at the moment across our range of businesses is that it has been more disruptive, for example, in areas like construction and house building than it has been in the more office-based jobs, where it has been possible, not easy, but possible to move a lot of people to remote and agile working. So one of the things we may see, which I'm trying to inject a little bit of optimism into the debate, is an acceleration in people adopting more flexible work patterns, more agile, home-based, anywhere-based type patterns, which could enable them to fit more easily around care requirements, whether that's care for their children or care for partners or parents or whatever it may be. So we might see something positive come out of this, but the first 6 months is not going to be easy in the labour market. I think we agree with that. Just to pick one other positive, which is germane to the labour market. We mentioned earlier underlying conditions being a factor in affecting those people who get hit hardest by COVID. And, you know, one thing that might come out of this, if government is deep thinking enough about it, is to say, let's spend a little bit more of the health budget on the kind of primary care, prevention, health condition management type of areas, rather than waiting till people get so sick that they need hospital care. Now, it's something they should have been doing anyway. Again, this might be a kind of a catalyst, if you like, to accelerate that process. So, for example, high blood pressure, diabetes, heart conditions, things of that sort, which are quite often manageable conditions which could be managed better. I think diverting a bit more of the budget into that would be helpful. And the last thing, again, on a slightly more optimistic note, we're spotting as a business and as individuals, is that, you know, a lot of us are spending much more time with our family and our extended families than we do normally, frankly, albeit it's done, you know, digitally and online. And, you know, I think in some ways, you know, there is greater younger, older connectivity being re-established in a face-to-face way, but differently. I mean, we had one of our responses to the crisis was to set up a community fund, which is initially £500,000, and we wanted that to go to small local charities helping elderly people and people suffering with mental health issues during the COVID crisis. In 10 days, we had 600 applications. And, you know, I think people are doing more in their communities across generations. Hopefully that will last. But for the moment, that is one little silver lining we're seeing.
I just want to echo that, because I think, you know, I said earlier that I think this is just accelerating us into the future. It certainly raised this challenge of a healthy economy and many more older people. But it's, you know, for too long we've heard about the future of work. It's already here, the future of work. And that's already then raising all these issues. And I think what's the most promising and positive thing about all of this is that as a governments around the world, they've decided to crater the economy to protect lives. Now, there's massive debate about how long it goes for and whether, they've done it right. But we've accepted that the most fundamentally important thing to us is our humanity. And I think that's kind of really important. We've also realized that we can't rely upon firms. Firms indeed have to rely upon the government to keep going. We've realized we have to rely upon family and community. And then we're thinking about work. We can then blend work and family differently, but not as it's currently done. I mean, look at the debacle around homeschooling. But I think ultimately we could see emerging from this a focus on how to make the best of these longer lives. And I think John's absolutely right that we hopefully and should see an increase in preventative health expenditure, but also just the sheer importance of the community and society. And what I hope most fervently of all is that we're going to start to see actually the voice of civil society start to be heard much more and say, this is our power and this is what we want. And I think that's been missing in all the debates around technology and also energy. So I hope that's the biggest positive. So I just want to echo John's point that, it's still very early days. We don't know what's going to happen, but there possibly could be some positives that emerge from this. And as I say, that valuing of life and community above all else seems to me to be a really, really good thing.
Yeah, I'm really pleased that, in talking about the sort of longevity economy, it's really important that we actually see health and people being healthy as a critical part of a successful economy, is actually just people being in good health and able to contribute in all sorts of ways, as well as work, hopefully for longer. You've done work, Debra, to sort of try and quantify some of that longevity economy. I wondered if you might share a few of the insights from that with us. And I suppose, really reflecting on some of, Andrew's challenge, I suppose, that, there are some positives. What are the business opportunities? We're going to spend a lot of time, I'm sure, talking about the downturn in the economy and these long-term economic sacrifices that we're making. But be good just to hear your views and some of those insights.
Absolutely. So we updated our projection of what the economy would be, what the size of the economy for people age 50 and over. And that's direct spending as well as the indirect economic activity that's caused by that. In 2018, it was $9 trillion total. And importantly, that also included $745 billion of unpaid activity. So people are buying things, but they're also volunteering. They're taking care of children. They're taking care of each other. We wanted to make sure we had a full picture of that. Now, this $9 trillion economy would be the third largest in the world if it was its own country, second only to the US and China. So we see for businesses this enormous market that often that they ignore. That, the fact that older people spend 56 cents of every dollar in the US, but yet many of the products and services really aren't designed for older people. We need more comfortable shoes. We need more things with bigger writing. We need things that aren't ugly. And the businesses that really actually move into this space can only see growth over time as this population ages and grows as well. In the healthcare sector, because we've been talking a lot about that, in particular, older people spend 63 cents of every dollar. And oftentimes, at least in the United States, which I'm most familiar with, we treat them as a set of diseases. Rather than people that need care across their entire health. We have a huge shortage of geriatricians in this country who can look and sort of trade off on the benefits of different treatments for older people. So again, the longevity economy is huge. It's growing. We are redoing those numbers based on the growth assumptions of how COVID-19, but that's 2018 numbers are already enormous, and provide a huge opportunity for a range of different types of businesses. Again, people over age 50 aren't all at home doing nothing. They're traveling, not right now, of course. They are buying technology. I think one of the things that this has shown is how many older people do have computers. In the US, it's about 90% of people over age 50 that have computers. They may not have been using them to order their groceries until a few weeks ago. But all types of goods and services are used, but perhaps need to be tailored slightly different. And we think that the needs are vastly outweighing the supply of good quality items.
So I think as we come to sort of the last, bit of time that we have together, I would really like, this conference is very much focused on, business, but also we know that public and private sort of working together is critical, and important that government and business, I guess, both take actions to support people to both, become and stay economically productive, offer them all the goods and services that they're going to need to age well. We've heard some areas where we're seeing businesses innovate around the housing market, where innovation's needed, perhaps around the care market and some of that preventative health. I just wondered if, you would each like to sort of perhaps talk about what actions you think are needed from business and government for us as we hopefully do come out of the current crisis, to be able to promote healthier aging in the future. So I don't know who wants to sort of kick off with any thoughts about action for business and government. I mean, John, do you want to give your thoughts on what's needed?
Yes, absolutely. I mean, I think the first point I would make is that when one talks of government, we tend to assume we're talking central government. In fact, local government has a massive role in this. And the experience we have at L&G is that, central government can send a signal and it can provide a policy nudge. And it certainly needs to do a few of those around the care market and care provision for older people, for example. But actual delivery of a lot of things happens at a local level in cities and towns and districts. And usually, local government is better at actual implementation or delivery than central government. And so the way that I would see this going forward is more of what we do already as a business, which is entering into partnerships with local authorities, trying to create new opportunities around urban regeneration, housing, communities, sometimes including services, which might include care and so on. We want to make these places great for older people of all ages to live, work and play. And I think this pandemic is an opportunity to step up that work. It's partly about age, but it's also partly about a multi-decade underinvestment in the UK. So we have to free up a lot of the money which we have in the financial system, and enable government to provide some kind of framework through which that can be applied to do good for older people, but also across all generations in their own location.
Thank you, Andrew.
It's a huge agenda, isn't it? I mean, to me, there's two things that are happening. There's an aging society in the sense that there's now more old people because the birth rate has fallen, and that creates a whole bunch of challenges for firms in terms of providing products. So that they need to switch from doing strollers to walkers, that type of shift. And then I also think you've got a longevity economy, which is that on average we're living longer and we're healthier for longer. And tapping into that is the really big economic advantage as far as I'm concerned. So how do firms respond to an aging society and longevity economy? There's a whole raft of new products to provide. I think it's a very complicated one for firms to respond to because, as we've said, everyone over 65 is not the same. They age differently. It's a very diverse market. And some of those people just look like traditional consumers. So actually, it's not an easy market to pin down. And I think that's why we see slight struggles in firms exploiting it. To me, the biggest issue is how do we keep people healthy and productive for longer? Governments, I think, should intervene in a raft of ways. One is, I think, they have a crucial responsibility in setting the agenda, just making people aware of what life expectancy is and the malleability of age. The stats that Deb showed us about inequality just go to the heart of how malleable age is. Governments are not creating enough of a narrative. They focus on period, not cohort measures of life expectancy. We have to focus on changing the narrative around age. I think obviously governments have a role to play in terms of discrimination legislation, but they have to focus on the areas where there's the biggest market failures, and that's health and education. We talked about preventative health. I think adult education is a huge issue. If you combine technology and longer working careers, governments need to see a mass expansion of adult education. And that's not really happening at the moment, but they did it in the Industrial Revolution. We need to do it again. So a combination of the private sector providing education, but also the state also providing adult education, I think is crucial. The other thing governments need to do is to look at the tax and benefit system, which is based heavily upon outdated assumptions about longevity, and think how to make sure that they can encourage firms to hire older workers. I'm not talking about having a bias towards older workers. I'm talking about removing some of the disadvantages that individuals and firms have in hiring older workers. So ultimately, to me, if we are living longer and healthier for longer, it's how do we seize that productive advantage, which comes back to the final thing around firms, which is hire older workers for longer. They are doing it, but they're kind of doing it without knowing it. And that's where, when it comes to recruitment and dismissals, you start to see the discrimination.
Deb, what would you like to add? I know you're doing work internationally as well on this idea of promoting longer working lives and some of the points that Andrew's made. What's your sort of ask, as it was, both internationally and back there in the US, of business and government?
Well, so I'm going to say ditto to everything that John and Andrew have talked about, as well as the previous conversation on housing and care. I think those are vital areas for investment. But I'm going to take Andrew's point a little bit further. We've been working with the World Economic Forum and OECD on a project called Living, Learning, and Earning Longer. And anybody who wants to reach out to us to join in is welcome to do it. And that is, any company that is trying to think about the longevity economy should have a workforce that represents it as well. The ability to have a multi-generational workforce and the importance of that as you develop new ideas is absolutely crucial. We think, we already know that those companies are more productive. We know that employees want to work in a multi-generational team. And we know that heightens retention over time as well. So all those things can make businesses much more productive. From a society perspective, I agree with John. There are things that the federal government here can do, or federal governments can do, but there's a lot of what state and local areas can do. We've been involved with the World WHO program on age-friendly communities, which I know has also been very popular around the UK. And these are local politicians in the US at the city level and now at the state level who have committed to thinking across issues like transportation, housing, healthcare, and social inclusion in a way to make their cities and communities better. The reason I add that point is because if we just think of how we're going to improve healthcare, but not improve transportation to get people to their doctor's appointments, or if we just think about housing, but don't think about maybe in a large apartment building having a nurse come visit, where you have naturally occurring pockets of older people. Those types of intersections of policies can be 10 times more effective, as well as much less costly. And so having some innovation around this area, both by including people in the design, but also thinking not just sector by sector, but where are those synergies, I think we can actually come out of lots of new innovations that can help not just the current generation, but as Andrew talks about, all of us who are having birthdays every year.
And certainly at the Centre for Aging Better, I think we also recognise and are promoting age-friendly employer practices, and also see the opportunity of the flexibility that is now available to everybody, at least those of us who are in more office-based jobs, working from home, to continue that sort of flexibility. And we really do hope that employers are going to embrace the need for a diverse workforce, and we really hope that the transition back to work for people is not going to create sort of intergenerational tension or age segregation around that. Also recognising the points we've all been discussing about the economic opportunity for business and the need for innovation. Been working very closely with the UK government, UKRI Healthy Aging Challenge Fund, which is looking to support innovation at all stages. And I think that's just really critical, is that, government does sometimes need to provide an enabling environment. It's not always money, but sometimes it can help. So hopefully this is going to be a global effort, both in terms of helping employers take action to support people to have longer productive working lives, that governments and employers will be supporting people to be healthier and to create and innovate new products and services for our ageing population. I found the conversation absolutely fascinating. I hope that those of you who've been watching have enjoyed the conversation and will be joining in the discussions that will follow. But thanks very much today to Debra, John Godfrey, Andrew Scott for a great panel. So thanks very much.